Now, in this one, I am showing a person, he is on fire, like a person under stress. As if he is running all the time. Actually, he is fight or flight or fight or run mode. And moment you ground yourself, now earlier it was beta waves in the brain which leads to stress and also the increase in cortisol hormone, which is fight or flight. Now the very moment you ground yourself, the brain waves turn to alpha waves and you become very calm. The parasympathetic nervous system takes over, and that is called rest and digest system. So that is a very beneficial system because your heart rate comes down, your blood pressure, sugar level, and your immune system becomes stronger. All those things happen. Right. Now, effects of grounding on the cardiovascular system. Immediate effect, as you ground yourself, there's what's called heart rate variability. That means between the heartbeats, the gap varies from one beat to another. Now that is very medicinal, or it's a very healthy thing for the heart. Instead of having beats at a regular level, the spacing is the same. So heart rate variability is one of the first things which happens to the heart as you ground. Then also, as I said, because the cortisol level comes down, the blood pressure comes down. Now, among my cases, there were so many, about 10 cases who reported that their doctors actually reduced the dosage of their blood pressure medications because there was better control of blood pressure. Then another important thing which happens is actually the blood pressure comes down because of the vasodilatation and thinning of blood. Now, thinning of blood is where the blood red cells are normally cling on to one another. So it's like, as Dr. Steven Sinatra says, it's like tomato ketchup or tomato sauce. Soon after grounding, the red cells get a negative potential on the surface of the red cell, which is called zeta potential. And zeta, when that becomes negative, the red cells can't remain together because negative can't remain together. So they are thrown away from one another, and then you get, so that is the reason for thinning of the blood. So the blood, which was like tomato ketchup or tomato sauce, becomes like red wine. So now that is and together with that, even the blood vessels, the arteries dilate. So now just imagine, now the heart is a pump which has to pump the blood right through your body. Now it becomes so much easier for the heart to pump blood when it is more like water, red wine, than when it's like tomato sauce. Then also when the vessels have dilated, it is so much easier. So that is why the burden on the heart becomes very much less, and the blood pressure also comes down. Now remember that if someone, especially heart patients, if they are on blood thinners, you can't do grounding because it will be too much. So if you are on blood thinners, remember you can't do grounding because this grounding also makes the blood thin. Now if you look at the heart, now there are coronary arteries which supply the musculature of the heart. Now also remember that these coronary arteries, as I have shown here in large, also have a blood supply. Now those are called vasa vasorum. Now they also open up when the blood is thin, and the vessels, they also open up. So you get a good blood supply to the coronary arteries also. Because up to now, mostly we look at only the intima of the coronary arteries. But the entire health of the entire coronary artery is looked after by grounding, because the blood supply to the coronary arteries also increases. Similarly, in the brain, you get the cerebral arteries. Now, even the cerebral arteries also have vasa vasorum, as shown here, tiny blood vessels. Now they also open up. So the cerebral arteries, the entire cerebral arteries also, the health is improved. Because up to now, I mean, mostly we only think of the intima, the inner layer, but the entire. So the intima also, the health will improve when these vasa vasorum open up and improve the blood supply to these both coronary arteries and cerebral arteries in the brain. Yeah, now for you to get heart attacks, coronary heart disease, or strokes in the brain, you get these atheromatous plaques. Now, up to now, no one knew how these plaques rupture, because when the atheromatous plaque rupture in the heart, you get a heart attack. When it ruptures in the brain, you get a stroke. Right. Now, in the 1990s, cardiologist Dr. Paul Ridka found that about half of all heart disease patients had normal cholesterol levels, and he thought there was something else which is responsible. And in the 1990s, he found that it was inflammation. It was reported, Ridka et al., New England Journal of Medicine, 1997. Now, very recently, last year, Dr. Dmitry Yarov, 31st of October 2025. Now, he says the blood test that predicts heart attacks and strokes turns out to be not cholesterol. He says that you may have atheromatous plaques in your arteries, but for them to rupture and cause heart attacks and strokes, there has to be chronic inflammation in the body. He also says that the test that outclasses cholesterol in flagging out the risk is the highly sensitive CRP, C-reactive protein test that measures inflammation in your body. For the atheromatous plaque to rupture, there has to be inflammation. Now they clearly demonstrated that. Now, if you ground yourself, there won't be inflammation, and then the atheromatous plaques cannot rupture. Another two important ways through which grounding helps prevent heart attacks and stroke is through giving with grounding, you get a very relaxing, healthy, deep sleep. Now, actually, a 50-year-old male who is among my cases, he had been wearing a watch which gives him a feel. Actually, he wears this watch right throughout the day, night and day. And before grounding, his deep sleep component was half an hour. But after grounding, and always the watch used to give a feedback that to indicate that his deep sleep duration is not enough. But after he started grounding, now it is ranging between 1.5 to almost 2 hours. So that is 3 to 4 fold increase in deep sleep component. Now that is the most relaxing part of the sleep, and it is the most healthiest, one of the healthiest part of sleep. Now, actually, among my other 303 cases, the very first benefit all these cases got through grounding was getting a very healthy, good, relaxing sleep from the very first day of grounding. Now, for example, there was a 63-year-old female. She had only about 1 or 2 to 3 hours of sleep for a day. And from the very first day of grounding, sleeping grounded, it went off, right? she recovered and she started to get a good sleep. Then another 74-year-old male, for 10 years he had insomnia, which he overcame with the first day of grounding. Then again, a 66-year-old Buddhist priest who for about 4 or 5 years he didn't have good sleep, and he started grounding from the very first day he got good sleep. He said, "This is a godsend. Make a matter deyo dinna deyak kiyala." Right? Then also a 50-year-old female, a diabetic patient, she said, "Mata dan maruna wage ninda yanawa." So that is actually how sleep comes into play, how grounding promotes very healthy sleep. Professor Lu Qi, professor and director of the Obesity Research Center at Tulane University School of Public Health and Tropical Medicine, a very prestigious institution in the USA. He says adults with the healthiest sleep patterns had a 42% lower risk of heart failure regardless of other risk factors compared to adults with unhealthy sleep patterns. Now, other risk factors will come to play, like various others, like high blood pressure, diabetes, everything, right? So, regardless, sleeping 7 to 8 hours, having no insomnia and snoring. Of course, there shouldn't be snoring also. That is the ideal. Now, sleep is, and also, now among my cases, there were 2 adults who had snoring. Again, those 2 also overcame their snoring after sleeping grounded. And also he said sleeping is more important in prevention of heart disease than diet and exercise. Sleep is more important than diet and exercise. So you can see what is the, now actually this presentation was done from his data collected from 408,802 people aged between 37 years to 73 years, and they were followed up for 10 years. So it's a very intensive study, which and also reported in the American Heart Association Journal Circulation.
Okay.
Then central obesity is also another risk factor for heart disease, cancer, diabetes, high blood pressure, all those. Now, grounding, you overcome central obesity. Now, I have 30 cases among my 303 cases who reported a reduction in their waist circumferences without resorting to dieting and or exercise. So without dieting and exercise, they achieved central reduction in their waist circumference. So that is helping to overcome central obesity. They say sleep, now again the sleep comes into this picture. Sleep less, weigh more, sleep more, weigh less. Now this happens because when you sleep less, hormone called ghrelin is produced in the stomach, which stimulates the appetite center for you to eat more and more. So you have uncontrolled eating. While leptin is the hormone which tries to prevent this thing, but when you sleep less, ghrelin increases, leptin comes down. So therefore you tend to eat more and weigh more, right? So this is when you sleep more, actually the ghrelin is reduced and you can't eat too much, and also the leptin is more active. So therefore there is sleep less, weigh more, and sleep more, weigh less. Another angle of looking at the prevention of heart disease, heart attacks and stroke. Actually, this was at a symposium in 2015 on cellular medicine, at Maastricht, the Netherlands, presented by Dr. Matthias Rath and his team. Now he says atheroma formation occurs due to cracks which appear in the arteries, especially at branching points of coronary and cerebral arteries. Because of the turbulence, there's more turbulence of blood at this point. Now, in animals, these cracks are sealed off with collagen, because in the animals you don't get heart attack and stroke, because they have the body produces vitamin C. So therefore they are protected from heart attacks and stroke, because they produce their own vitamin C in their body. We humans and subhuman primates, if there's a lack of because we don't produce vitamin C in our bodies, so if there's a lack of vitamin C, collagen cannot be formed to seal these cracks, because these are very dangerous, because the cracks can widen and you can bleed to death. So, as a temporary preventive measure, substance called lipoprotein A comes to our rescue. But unfortunately, this is a very sticky substance. And and then in the long term, this goes on building, resulting in atheromatous plaque, because there's more fat and cholesterol started to deposit on this plaque. And then it goes building, and you can have heart attacks and strokes. And so what they recommend is, if you take adequate daily intake of vitamin C, what they recommend is 700 milligrams, we will have enough vitamin C in our body, in the arteries. So if and when these cracks appear, it will be sealed with collagen, and we don't have to depend on the lipoprotein A, the sickest substance, which can ultimately lead to a atheromatous plaque. Then also, in their studies, they found that by giving a person who had atheromatous plaque, by giving 700 milligrams of vitamin C daily, the plaques actually began to dissolve and became smaller and smaller. Now, vitamin C is a water soluble, it's also inexpensive, and it's water soluble, so don't get frightened thinking that you might get overdose vitamin C, because vitamin C is water soluble. It will go pass through the urine, any excess you take. Just want to, now I spoke about vasa vasorum. Similarly, in the legs also, you get long nerves like sciatic nerve and other nerves. Now, that for those nerves also, there is a tiny blood vessels called vasa nervorum. Now, they are also important, because when you do grounding, they also open up. Now, among my cases, there were so many, about 4 or 5 with sciatica, who had been taking various medicines and vitamin B12 and things like that for many years, but they hardly had any good result. But moment they grounded, they overcame the sciatica which they had for many years. Now, the reason for that is that the sciatic and the other nerves, the blood supply, like the tiny blood vessels, vasa nervorum, they also open up and give a good blood supply to the nerves, and that is how they overcame the sciatica and also the numbness which they have there in their feet. So that is just, I like to mention that also what happens with grounding. These tiny blood vessels in the nerves also open up, and you overcome these problems. So regarding grounding, you actually, as Dr. Laura Conifer says, like we charge a cell phone daily, we should charge our bodies daily with the direct current coming from the earth. So you can't just do grounding haphazardly and expect any good result. But like, of course, the cell phone, we charge the alternative current which we come from the electricity. but the earth has direct current, and our body also works with a direct current. So that is why, like the cell phone being charged daily, we have to charge our bodies daily with the direct current coming from the earth. So that is also important to remember. Then also do not ground if you are suffering from bleeding diseases. Then do not ground if you are on blood thinners. Never ground when there is lightning. Do not use a cell phone while being charged. Then you can't use that cell phone while being charged, and do grounding. Then also do not ground soon after a heart attack or surgery or after stroke. Then also before going for surgery, at least 1 week before going for surgery, better stop grounding because the bleeding tendency. Then also if you are having fever, don't ground yourself. Then also, of course, do not ground if you feel severe discomfort. But that, of course, now this is actually Dr. Laura Connier says, but I have not come across a single case who had such discomfort among my 303 cases.